Fine.
I love the fact that you care for us so much. He's such a, he follows me around like a dog. He's a
All right, we are all set. We're live on YouTube, so we should be good.
Great, thank you very much. I'm going to call the meeting of the Plainville Board of Education Thursday, August 26th at 6:30 p.m. To session. This is a special meeting for the discussion regarding reopening of schools and to take public comment. So the superintendent is going to give us a brief overview, but when he is done, we're going to take some public comment. We're going to ask folks to, when they're allowed to speak, to give us their name and their address in Plainville, and we're going to limit speaking time to 3 minutes. We're asking everyone to be respectful, and we will hopefully be able to hear from everybody this evening. So with that, Superintendent Lepage, if you have a brief overview you want to give us.
Thanks, Chairwoman Tyrell. I appreciate the members of the Board of Education being here tonight and working with me to orchestrate this meeting on opening our schools. I want to thank the members of our administrative team for being here as well to hear the comments that are shared tonight. You know, we do have the comment feature also that anyone who's watching the meeting can also enter questions or comments regarding you know, the topics for tonight. You know, if we're not able to get to everything tonight, we will certainly put together you know, FAQ, frequently asked questions and answers document that we can share out if there's anything we don't touch upon tonight. So this has been a very challenging time to be a school leader, a board member, a school leader, administrator, superintendent or otherwise. Ever since March of 2019, faced with, you know, the word unprecedented has become cliche, but unprecedented times. I'm sorry, I also want to thank Dr. K for being here from the Doctor's Treatment Center as a medical expert to hear kind of the concerns that may be voiced tonight, and also, you know, maybe offer some follow-up. He's been a great partner and with the district for our testing and many other things as our medical advisor. So thank you, Dr. K. So just getting back to the challenges of this time since March of 2019 have been significant. I don't have to tell it to anyone who's here or watching tonight. It's been really an incredible time of making decisions in real time and having the guidance that shapes those decisions sometimes change overnight and having to adjust from there. It's been a time of trying to keep everyone safe, trying to keep everyone well and feeling supported and learning, while also trying to ensure physical safety and mental health and wellness, while providing equitable resources and learning opportunities for our kids the best that we could, using technology, using a whole myriad of tools within our toolkit in Plainville, which is a very strong one, thanks to the Board of Education support over the years. You know, I'm proud of the work that this team has done, that our teachers have done, in cooperation with our really outstanding parents in Plainville. I do want to thank the parents who are here tonight, regardless of what your opinion is on different topics. You know, we work as a community and as a family within this district and do our best to support everyone as well as we can. And I will say that the challenges that we have faced and the decisions we've had to make are not going to be widely accepted by everyone in many situations, which is the case that, you know, we're all very familiar with at this time. So just coming out of the complete state shutdown and quarantine back in March of 2019, and us flipping from fully in-person learning to fully remote learning for about 3 months of time, and planning for that and making it happen within about less than a week's time without missing a school day. That took us to the end of the 2019 school year, 2019-20, I should say 19-20. Last school year, as everyone knows, we were tasked with coming up with a plan that involved 3 different learning platforms: a fully in-person, a hybrid platform, and a fully remote platform. With all of the resources, technology, training, support, And everything that went along with that, 50-page guidance document, and our document that stated what we were going to do as a district of Plainville was just about as long, along with all the other addendums and attachments and changes, and adjusting to the frequent shifts we had to make, constantly doing, as Stacy Beaton, our HR director for the town and the board, is well aware, and Julie Samard, our COVID liaison, who's here in the call as well, constantly, weekends, nights, always working to do the contact tracing when we had a positive case, doing the quarantining in our classrooms, everyone doing the mitigation strategies with fidelity as best as we possibly could, and really having throughout the course of last year, there were no cases that were confirmed to have been spread within the schools. We can say that with complete honesty and transparency, there were less than a handful of cases that took place within the same room, but there were also positive members of the family at home, which was much more likely to have contracted it at the dinner table than in a classroom on opposite sides of the room with all the strategies that were in place in our schools. So that being said, we're really proud that we were able to provide strong educational programs during a very difficult time. And when I talk to other families from other states and other parts of the country who have been remote ever since 2 Marches ago, I'm looking forward to hopefully going back now. I'm really proud of the work that we did as a district. So that's just an overview leading up to this year. Coming into this year, we were tasked with a couple of things in guidance. We're no longer allowed to provide remote learning as a school choice. The only remote learning that we're allowed that's approved by the state is for quarantining and isolation related to COVID cases. That will have to continue as necessary in order, as one of our mitigation strategies to protect from spread. And the other situation would be for very unique situations for students with severe medical challenges that would be covered through our typical special education in 504 services where it's not possible for them to be in school in-person learning. And those would have to be determined by a planning and placement team or a 504 team that would make those unusual decisions. But the majority will be in school, in learning in person. The results that have come back thus far on assessments show that learning in person is by far the best learning modality as far as getting the best results, the best outcomes, the best mental health supports, and the best learning. It's just not the same. And there are many factors that interfere, or many variables for students who don't have the same levels of supports, or parents who can both be home or one be home and really guide their learning at home. As an adult, families have many challenges, many different jobs that restrict that, and it's not the family's fault. It's not the school district's fault. It's just situational obstacles that everyone had. Many kids had a different learning experience last year. So this year, going into the year, a few things. We had to have by June 26th of this past June, we were required to submit a fully in-person learning plan. They called it a reopening of schools plan. We called it a continuity of learning plan because we were in fully in person. We started with 4 weeks of hybrid last September, and we were fully in person for the duration of the school year last year. Only having to close one school for one day for a very late Monday morning contact tracing, I should say, COVID case report that came in just before buses were about to roll. So that was one case at one school related to a gathering that happened over the weekend and inability to contact trace in time. Other than that, we remained, all the schools remained open and doing great work and learning every day. It wasn't perfect work, but our staff, I couldn't be more proud of our staff. So this year, getting back to where we are now, the guidance called for in-person learning. We submitted that plan by June 26th. And since that time, at that time, Mr. Lewandowski, my assistant superintendent, and I, really put that together with, insight from everyone. But there were a lot of comments in there, per health department guidance at the time school reopens, or, based on the latest health and mitigation requirements of the health department. Because, there are things that were changing. And over the summer, as everyone knows, our cases dropped to almost nothing at one point, and then they started to rise again due to different variants that, I'm sure Dr. K could share. He's seen a rise in his practice, and as you hear about in the state, on the news and on the reports from the Department of Health, both state and local. I do have those meetings every Tuesday morning, and some of the members of this team attend those meetings as well. We get the latest numbers and updates about what's happening in our state and in our region, in our town. We also get the latest, I didn't move enough, so. Sorry, my lights went out. I need to talk with my hands, I guess. We also received the latest executive order updates from the governor and recommendations from the State Department of Health. Those come in the form of the packets that I've sent out to families with the updated guidance for mitigation strategies in our schools, and then our executive orders from Governor Lamont. The first of which extending the mask mandate for all inhabitants of schools, staff, students, fully vaccinated individuals, visitors, to be fully masked through September 30th. At this time is when the executive order expires. Subsequent to that, the governor issued another executive order mandating vaccinations for a number of different groups, including state employees, hospital workers, and boards of education employees and contracted employees of the Board of Education. So that includes things like bus drivers and anyone who's working in our schools on a regular basis. I won't get too far down that guidance, but that basically requires by September 27th for all school employees to either be fully vaccinated or have one dose of a 2-dose vaccine if they're getting a 2-dose vaccine, and have the other one scheduled, and then test weekly until that one takes place, or to meet one of the exemptions for medical or religious exemption that are clearly detailed and outlined in the guidance, or to have weekly COVID testing, as an alternative that would be required. So that was just learned about last week. So a lot of things have evolved as we're putting together our mitigation quick reference guide, the one that's blue and light gray that was sent out as an update to our June 26th plan. Our school principals and their teams have done a great job of updating their school plans and really explaining the differences between last year and this year. The biggest differences that were released are a decrease in the classroom of masked individuals. Everyone wore masks, but decreased to 3-foot distance in order to be considered a close contact within 3 feet. It was 6 feet in the past. And oftentimes we're quarantining an entire class, especially at the elementary school level where the kids are moving around and they may be within 6 feet of each other. It's really hard to verify they weren't within 6 feet of one another in an elementary school, especially the really younger grades where the kids are pretty active and moving around. So we were quarantining whole classes, especially in the elementary last year. Other changes, really just distance required. No masks are required outside. Masks are only for inside. If you're outside, they still advise, the health department still advises that if kids are sitting sedentary, say, within close proximity of each other, hearing a story outside, it's safer to have a mask on just because you're in very close proximity. Somebody sneezes in another kid's face, happens to have it. That wouldn't be, desirable thing. So, but I would say that most of the time when kids are outside, it's a mask break. They're running around, they're playing, they're at recess, or they're in a PE class outside, getting a fresh air break. The masks will be off outside. In the cafeterias, we're ensuring at least, we're ensuring more than 3 feet, 3 feet or more in our cafeterias. The rule for quarantining in cafeterias in any space for anyone other than students in the classroom is still 6 feet. So if you're within 6 feet of an individual, of a COVID positive individual for 15 minutes or more within a 24-hour period of time, you're considered a close contact and would have to follow the quarantining rules. Other than that, just a few other changes. Last year, if you were at the high school or all the schools, we had the directional arrows everywhere. We had one-way traffic pretty much going everywhere in all the schools. We had I call it the Jersey barrier down the main hallway at the high school, the big orange highway divider, basically, just separating traffic. Those things are less of a concern. This year, everyone masked, just walking to class for a very short duration of time, moving from class to class. The cohorting is also less emphasized as a mitigation strategy of importance. So this year, it's really, even with the rising, the Delta variant, which I know is a concern to everyone or to many. The main things are, wearing the masks, continuing to wear the mask at this time to prevent spread. They worked last year. I'm confident they'll work again. And then just following the other mitigation strategy with hand hygiene, before and after eating, and regular hand hygiene in the schools. Washing hands is definitely desirable. Antibacterials are okay if you can't wash your hands, but washing hands is preferred. So all those things will still be part of our plans, as you already saw. I guess I'm going probably into more detail than you might need because you've already seen our plans, but so I'll stop there. If I left anything off that is important, anyone on my team, feel free to just add to it. But I tried to cover kind of where we were, what we went through, the guidance that led us to this year, the executive orders that govern what we do. And just to clarify, there's been talk about, what's the power of an executive order? It's just the governor's just making an order, but what does that mean? Shipman Goodwin and Attorney Tom Mooney has really clearly stated that if boards of education or superintendents or school district leaders or employees intentionally go against an executive order, the executive order has the enforcement power of a law. So it would be a very bad thing to do for us to do that, first of all, for the health reasons, but second of all, for liability reasons for the town and for the Board of Ed and for individuals. We received a clear guidance document from Tom Mooney on that. So many factors that go into these decisions, but some of the decisions, such as masking and now the mandatory vaccination for school staff, they're non-negotiables. They're really non-negotiables for school district leaders. Some of the small nuances of our school reopening plans are more negotiable, and we seek input and insight, from our stakeholders on those, and can make adjustments as needed in the interest of safety. If we deem that, to be a good idea, always running everything by the health directors, the health department, who meets with the CDC as well. So I guess with that, that's in a nutshell where we are today. We are opening school for students. We have a higher enrollment that we've had in a couple of years. Our enrollment's up. We're over 2,300 students now. I'm really excited to welcome our kids back and to see them in our schools and to keep everyone as healthy as we possibly can. We're going to do great things this year. We do have grant money through the ESSER grants, and we're going to do a lot of great and innovative things for kids. So I'm looking forward to welcoming our kids back, keeping them safe, keeping them learning, hopefully keeping as many of them in school as we possibly can, and hopefully moving past all of this and being able to talk about more typical things. Sometimes I feel like an epidemiologist or a medical doctor, which I'm not. Dr. K, that's your expertise. I hear it every single week and every single day, and it's what we do as part of our job now. So definitely wasn't in my superintendent preparation course, nor the courses of all my colleagues here, so nor the Board of Ed. So with that, back to you, Chairwoman Tyrell, and if you wanted to open it up to.
Sure. So we'll open up to public comment. Kevin is going to assist us here with letting folks in. Mentioned earlier, we're going to have a 3-minute time limit. We're going to ask that you start off by giving us your name and your address, and we'll go from there.
Okay, so I'm going to work my way down the list of attendees. If you would like to talk, please press the raise hand so that we know which persons would like to talk. Just gonna give this a minute for more people to do it.
Chairwoman Tyrell,
The-
if you wanted to just share kind of the process as far as public comment and, you know, if some individuals aren't familiar with the process at a typical board meeting, it's really hearing public comment, but not, you know,
Yeah,
not
So-
responding at the time.
right. You know, the Board of Education has a policy process, practice, I guess I should say, of taking public comment, but not really responding. And we do that for a couple of reasons. One is that we know that this is the time for individuals to express their opinions to us. And oftentimes, if it's a very simple question, somebody wants to know one specific piece of information, of course, we'll respond to that. But oftentimes, some of the questions that are asked are not something that we would answer right off the cuff anyway. And we can always, you know, obtain that information to people if they have a question. We do have a question in the chat box as well. So I don't know if we want to wait to the end to do that, or if we want to try and answer, or we'll look at that one first.
All right, we have 3 panelists. I'm going to start at the top, if you guys are ready. I'm going to allow Kurt Benson to talk. And you should be able to possibly turn your camera on too, if you would like to. You'll have to unmute. There you go.
Not sure how to turn the camera on.
Camera's on or no?
It's not. If you'd like to, I can promote you. Me to do that. I'll promote you to a panelist. That should allow you to turn your camera on. You're muted right now. There you go.
Okay, my name is Kurt Jordan Benson of 108 Ledge Road. I want to start by saying thank you to Miss Vicky Trzynski for running such a wonderful special education program. My son's been in there for 2 years. The leaps and bounds he's made in 2 years are astronomical. I was born and raised in town, have 3 young boys, and I have every intent to send my children to Plainville Public Schools until I realize the massive level of government overreach in public school systems, whether it's federal or state. I'd like to start by reading rule number 1 of the Nuremberg Code. The voluntary consent of the human subject is essential. This means that the person involved should have the legal capacity to exercise free power of choice without the intervention of any element of force, fraud, deceit, duress, overreaching, or other ulterior forms of constraint or coercion. With that being said, I'd like to ask a couple questions. They are rhetorical. We know now there's no distant learning options available after Lamont's mask mandate. What are the kids who parent children being masked? Here's the things with a child developed based on social interact and emotional interaction. It's tough to see any of that while wearing a mask. If I don't comply with your mask mandate, what happens then? Do you send my child home? Are you going to prevent my child from an education if I don't comply? Are you going to prevent him from getting the education that I help pay for with my tax dollars? I would like to take this time to help some of the audience understand how we have gotten to this mask mandate policy. Our superintendent of schools implemented this mask mandate solely on his own. He did not converse with the Board of Ed members prior to making the decision. We, the people, elect the Board of Ed. We, the people, do not elect the superintendent. Public schools get a certain dollar figure per child enrolled. That dollar figure is estimated on projected enrollment. When enrollment is down due to parents like myself who prefer to homeschool their children rather than send their child to school in a mask, the school gets less money than what was budgeted. When the school gets less money, people get pink slips. All I ask is when the time comes and people get laid off, that we, the people, demand we start by laying off the man solely responsible for implementing the mask mandate. It was during these Nuremberg trials where members of the media who lied and misled German people were executed, right along with medical doctors and nurses who participated in medical experiments using living people as guinea pigs. Those who forget the
15-second
past are
warning.
condemned to relive it. To the parents on this Zoom conference, the power resides with us. We, the people, do not have to wear their fear. Our rights do not end where their fear begins. We, the people, do not have to comply. I will not comply. What we need now is mass, non-violent, civil disobedience. It's the only way it ends. I'd like to end by explaining the term mandatory to the audience. If something is referred to as a rule or guideline or as compulsory or mandatory, it is not a law. You're not legally obliged to comply, as they require your active consent. You cannot be forced by law enforcement officers or government, as these are not laws. So I urge the parents to not comply with the mask mandate. Pull your kids out of school, send your kids to school with a mask. They can't send them all home. Courage is contagious, so let's be courageous.
Okay, thank you.
Thank you, Mr. Benson.
All right, next is Carissa Clark. I'm going to promote you to a panelist so you could speak and turn your camera on if you'd like.
Hello? Can you hear?
Yes, we can hear you, Ms. Clark. You can go ahead.
Okay, thank you. My name is Cassandra Clark. I'm at 39 Pier Street in Plainville, Connecticut. My first question is for getting children up to speed on basic reading and math skills. My concern is that over the past 18 months, there's been a general slide and decline in the basic education, especially on the elementary level. It was very difficult with my children home to manage, especially at the first half of it, without writing papers and such for a first grader to learn critical basic writing and arithmetic off of from Chromebook, etc. It's very much a concern for me. My daughter went through second grade with the Chromebook. We did do better last year, but now she's going into third grade. But I know that there's going to be some deficits, and my concern is trying to make sure as a whole, Plainville makes strides in those basic skills. Second, with COVID being such a change for everyone, it is a very big change for the children. I know that as a whole, children are resilient, but they have had lots of struggles with social, emotional growth, depression, being scared, not knowing what's going to happen next with school. Are they going to be quarantined? Are they going to see their friends? Are they not going to see their friends? And I'm hopeful that there will be more social workers available in the schools, especially on the elementary level, to help meet the needs of the children. My high schooler is doing much better with managing the changes than my elementary student. Now that COVID positive children are allowed in the classroom, as long as they're 3 feet away and wearing a mask, I'm wondering what is the intended or what is the anticipated level of quarantining that's going to take place as the school year progresses. Last year, you know, if there was a positive case, everybody stayed home. And it seems a little ironic that the Delta variant is
30
more
second
easily.
warning.
Pardon?
You have 30 seconds more. Please try
Okay.
to wrap up.
Yep. And then finally, my daughter does see wearing the masks as a step backwards, because you go from summer where they're around the kids and the parks and groups, and now with their friends, and now that they're in school, they all have to wear the masks again. And they do see it as things are getting worse, not better. So I just wanted to close with that. So thank you very much for your time.
Thank you so much.
Thank you, Ms.
You're
Clark.
welcome. You're welcome.
Next, we have Sarah Limmer, I think. I'm going to promote you to a panelist. I always want to try. Let's go here. There we go.
Hi, Sarah Limmer.
Hello.
Address, hello, is
Yeah.
24 Eastwood Drive. I have children in Wheeler School and going into the high school this year. I don't have too many questions. However, I would like to log in to show my support for Mr. Lepage and the decisions that our Board of Education has made over the last year. I am grateful that they have been based in science and common sense, and that they have not been swayed by the bullying of someone in our community. I am also a lifelong Plainville resident, as were my parents and my grandparents. And I am thankful that my children go to schools where we are wearing masks to help cut down on the spread of COVID, because as a nurse who also works in our community, I see how it does work, and I understand the science behind the virus, the variants, and the vaccine and mask wearing. And I would hope come September 30th, when the decision is made to continue wearing masks, as we see trending throughout our country, the numbers getting worse, that we decide to continue to keep our children wearing masks in school. I have not seen a decline in my children's happiness, well-being, ability to adjust, whether they don't want to go to school or not go to school. I've had kids that had to quarantine last year who were in person, and it had flowed as seamlessly as possible. So again, no real questions. I just wanted to thank everybody for putting our children first and for not giving in to the bullying of some residents in this town, and continuing to make the right decisions for the health and safety of our kids. So again, thank you.
Thank you so much.
Thank you, Ms. Limmer.
And last person with their hand up is Kelly Naira. I'll promote you to panelist. There we go.
Hello, can you hear me?
Yes, we can.
Hello, my name is Kelly Naira, and I live at 92 Rockwell Avenue. I don't have any real questions. I too share the callers, the last panelist perspective. I just want to take a moment to thank everyone on the Board of Ed and Mr. Lepage for all you did last year to keep my son, who has a serious underlying heart condition, safe. To say that it was terrifying to send him every day to school is an understatement. But because he has an IEP, he needed to be there. And so I do appreciate everyone following the science and doing everything you can to protect our kids. I do have one concern, which I hope will be addressed at some point this year. I know that due to the disruption to the school year, both at the end of the 2019-2020 year and some interruption last year with remote learning. I do hope that when the students return in the fall, that the teachers will consider that and not just go back to a regular fast-paced curriculum, especially our students who have IEPs and 504s. I really hope that the staff will take that into consideration. I know, it was a challenging year for everyone, but I hope that staff will recognize the difficulties that the students faced, not just academically, but also socially, and that there'll be more social opportunities for students, especially at the high school level this year, so that they can feel like it's more of a normal school year. So that's really it. And again, I just want to thank everyone, and especially Mr. Lepage. I know, we've had a number of conversations over this last year, and I am extraordinarily grateful for your leadership and for all that you've done to keep Dale, my son, as well as everyone else safe. So thank you.
Thank you.
Thank you, Mrs. Naira.
We have one last person who raised her hand, Rachel Buchanan. Promote you to panelist. There.
Hello, everyone. Can you hear me all right?
Yes, you can.
Hello, thank you. My name is Rachel Buchanan. I live at 134 Broad Street here in Plainville, Connecticut. I am a lifelong resident of Plainville and went to school here myself, grades 1 through 12. I would like to also thank Mr. Lepage, Superintendent Mr. Lepage. I cannot imagine that this is easy for you. Thank you for the Board of Education and everyone. I no longer have a child in the Plainville school system and could not imagine where everyone is faced with these decisions right now. The question that I have and the concern that I have, I'm someone who approaches things. I like to understand things peripherally and look at them to gain understanding. And I seem with this topic, because I am also not a doctor, a medical professional like Mr. Lepage, and I'm trying to keep up. The question that I have with Plainville schools having an emphasis on social and emotional learning, and with us receiving quite a bit of funding potentially coming with a lot being spent on that, have we been looking at, regardless of if this is, I understand that sounds like basically we're in no position to call the mass call or not. Our superintendent isn't in the position. It doesn't sound like. It sounds like enforcement means if anyone doesn't comply, mandated enforcement, that sounds like you could be arrested. So if you don't want to be arrested and you want to understand and you want to follow science and you want to be kind and you want to keep kids safe and you want to support our school system, are we looking at spending any of this money on the social and emotional learning? The last person said that their student hadn't had any negative effects. I'm really happy to hear that. The last thing I want is for children to have negative impact from all of this, but unfortunately they are. And it makes me nervous that our governor and the commission want to put superintendent of school to be the sole one to make this responsibility to create potential long-term problems for children. Is there any money being spent on the long-term research of negative mask wearing in the Plainville school system with any of this money? And I just lastly want to end with the comment that, again, I don't have a child there this year, and I don't know of any bullying in the town. I would not say that that didn't happen if that last person said that it did. My concern is when people ask questions and don't just automatically comply and have really valid questions. I get asked questions from parents often.
30 seconds, thank you.
I get asked parent questions regarding these topics often, and I have the town of Plainville's back. I'm from the Ville. I have the Ville's back. I have all of you guys' backs. I just want to make sure that bullying isn't interpreted as asking questions and pushing back. We all have the same goal, which is to keep these kids as safe as possible. Thank you very, very much.
Thank you.
Thank you, Ms. Buchanan. I don't see anybody else with their hand raised, but we do have a question in the Q&A. Given the increase in cases, why are teachers and staff not required to be tested before the first day? I don't know, Mr. Lepage, if we want to talk about, maybe even have Dr. K talk about if there's any efficacy of having everybody tested. And that is a question I know a lot of people have about testing and not testing mass amounts of people in the schools. And I don't know if there's anything that anybody would have to, pitch in with that.
I think it's a snapshot in time. So, whether they test on the first day and they may not test positive, they could go home and go to a ball game that night or just be hanging out with a group of kids. So whether it's the first day or each day of the, unless you were to test every day of the week, every student and every, member of that building, you wouldn't have 100% surefire way of, knowing that everyone in that building may not have it. Dr. K is the medical doctor, but, I just don't know of districts that are doing that. I can certainly understand the logic in that question, though. Dr. K, I don't know if you have anything you can add from a
Sure.
medical perspective.
Sure. Yeah, I understand where the question's coming from, and I think your answer was kind of key. You could go home and test positive the next day with a new exposure. The vaccines are to protect the individual, and virtually no one is hospitalized who's been vaccinated. On the other hand, the masks are to protect other people, whether you're positive or negative. The mask, particularly if you choose an KN95, you are protecting people who cannot be vaccinated. And that really clarifies why the mask mandate was brought in. And I think it makes absolute perfect sense. Children under age 12 cannot yet be vaccinated. And I understand there's in process a mandate to vaccinate staff. And I think that makes perfect sense. The history of vaccinating people en masse goes back to before we had a republic, and the first chief executive to mandate a across-the-board vaccination was George Washington, and to vaccinate his entire army because they were losing more men to smallpox than they were to the British. So vaccination to help for the individual, and then the mask shows concern for anyone who can't be vaccinated. And the testing, necessary testing for vaccinated people, very questionable, because even if you do develop COVID, the odds of progression are small. So should you get tested if you have symptoms? Yes, you should get tested. If you're at some higher risk, should be followed by your physician. There are some interventions that are now available, like Regeneron, COVID, antibody cocktail that can reduce risk of progression and death, but that risk is very, very small for vaccinated people. So I think that answers the question. I hope it does, unless somebody wants to follow up on that.
Thanks, Dr. K.
Thank you, Dr. K. So, in case you joined us late, and I think pretty much everybody's been in here together, if you have if you would like to speak, you can raise your hand, and then Mr. Ross will let you into the system. So right now, when we're looking at the list of attendees, we don't see anyone with their hand raised at the moment. I don't know that we have any further public comment that's out there at the moment. I guess at this point, seeing as though we have no further public comment, guess I'll I'll call it again. So I'm going to close public comment. That's generally what we do if I don't see anybody pop up in the next call here. So if you would like to make any more comments to the Board of Education, please indicate by raising your hand in the box. Going once, going twice. Again, if you would like to make a comment. You also do have an option of using the chat box as well. All right, given that, I'm going to close public comment and ask if members of the board, I know maybe members of the board might have questions or may have a question about something that was just brought up. So anyone wishing to speak, obviously go ahead and do so.
Becky, I have a question. It's Deb.
Yep.
After the 30 days that at the beginning of school, they wear their masks. What's going to happen after that? Are they going to revisit it to find out? Are they going to still have to wear the masks? Will they not?
So I'm just going to pitch this in there, Deb, just because basically what's been happening all along is with a mandate like this, they're going to at least a week, I would hope a week in advance of the September 30th date, they're going to revisit this and depending on what our numbers look like, I would say that would be how the decision would be made, because decisions are basically being made based on the science now. So I'm hoping we're going to continue to do that. So I would say that's the case. And I don't know if Mr. Lepage or anybody else would have a different thought, but that would
It makes sense, but I was just wondering, what their next move would be for this. I kind of thought that was it, but I just wanted to be sure. Thank you.
Welcome. And it, it'll all depend on what happens. I mean, we could be fortunate and maybe things will go, the other way and we're in a good place or,
I think that's accurate. Becky, I think that summarizes the process we've been following. An executive order has come out with a timeline and an end date, and then we typically receive guidance, not with a lot of time to spare, but they do assess what's going on across the state with our numbers and infection rates and other data points, and then they have either renewed an order or made a new executive order. So we'll see what happens as we progress. That'll be about a month into school for us. So
thank you, Steve.
thank you.
any other questions on the board? Comments?
I have a question. One of the things I've been hearing about most from friends and other parents, or the biggest concern I think I've heard, is the cafeteria spacing. So I'm assuming that will be being reassessed as things go, and if there were cases, you would look at the spacing between kids. There seems to be some confusion as to why we would start contact tracing at 6 feet, but we're allowing them to sit 3 feet unmasked to eat.
Yeah, that's another understandable point of concern. That was something that was shared with us by the State Department of Health as the new guideline with students maximizing the space that you have. They emphasize the priority of doing the best with the space that you can with limiting factors that you have, but making sure that all students are in-person learning as the top priority. But we've done a good job of getting creative. We're still working on adjusting and adding tables and adding spaces, and we have heard the concerns from some parents, and we're doing our best to adjust that accordingly. I could just speak to the high school, for instance, was able to move from 2 lunch waves to 4 lunch waves, and then also has some additional spaces where kids can go during lunch, auditorium or the library, media commons as an alternative place. So reducing the population density in there as much as possible. I know Principal Roberts is doing the same thing with the best that she can at the middle school, reducing adding more tables, adding outside spaces and any other areas. I don't know if any of the principals have any other updates. And I know that we're about 4 feet or more in most locations, really being thoughtful about not having kids sitting directly across from each other face to face. You know, they did remove the plexiglass as a recommended strategy as a mitigation strategy. It's an additional comfort, but there's no proven data to support that it really does a lot. We didn't invest in tons of plexiglass. We relied more on spacing, but we will still use some of that just as an added feeling of safety in some areas. But if any principals wanted to add any more, I'm just kind of rambling on, but any principals have any details that I missed, and like you said, Ms. Martinez, we will definitely assess and keep a close track on that. We had really good success in the past, you know, but we were closer to 5 feet at most of the elementary schools anyway, with plexiglass barriers. That was permitted by the health director. So that, you know, just about on the round tables, there was a plexiglass going across the center. So we were able to space about 5 feet. We're closer to 4 now. But is that fairly accurate, elementary team and Principal Roberts, Principal Johnson?
Yes.
Okay.
I would say our classroom spacing is closer to 3 feet, not 4. We are, you know, with all of our students back, we are pushing the limits with space at the middle school. We have a lot of new registrations, which is great, but it does make our space a little bit tighter. And we are definitely working on alternatives for our cafeteria to make sure that we can fit everyone safely. And we do have a few overflow areas. Last year we utilized outside very frequently. So we, you know, plan to continue to do that as much as possible to make sure that we have alternates and not just the caf, because it is pretty small.
And the other thing, Amy, is it, you know, when the classes are eating, is there a way to kind of keep them in their groups? I mean, I'm assuming there's an effort made to do that. I'm not sure if it's realistic at that age group.
So the original guidance that we had when we first discussed this was the importance of seating charts, so that when we do contact trace, you know, we had that accurate, and we have printouts of every table in the cafeteria. And last year we were able to, you know, we had a smaller number, but we just assigned students. Well, last year we didn't even have to assign student seats. I just took a seating chart each day. I was the one in the cafeteria. This year we have already informed students that we do plan to, they can choose their seats, and then we'll make the seating chart from there, because that is the only social time that they have during the day. They don't have recess. You know, their classes are dictated by all the constraints of their schedules. You know, we can revisit that if the guidance is to head back to cohorting, then, you know, we could certainly revisit that and make tables, turn those back into more like their homeroom tables, or at least their teams. So we will definitely look at that and follow whatever guidance, you know, we need to on that.
The other question I had is, how are we looking for spacing? Is there any feedback from DATCO yet on busing? Because I would imagine there might be a lot more students on the buses.
So as far as the buses go, everyone has to be masked, and we will have, my understanding is we're going to have seating charts at, you know, for each of the buses. You know, Sam, I know Sam Adlerstein's on the call. He's my director of business and operations. Sam, I don't know if you have any numbers for buses, or we can certainly get that information for the board. I don't have it at the tip of my fingers, but I know they're doing their best to have seating charts in the space that gets out as much as possible. And there is a federal requirement on public transportation to wear a mask at all times. So kids will be masked on the buses.
If cases go up, would that be something that would be assessed, like possibly like staggered busing or doing things like that? I know that was talked about early on last year and that wasn't needed, but.
Sam, did you want to just add anything else to that?
Yeah, DACO just finished the routing today, and we really won't know ridership until the beginning of school. And so they did their routing based on the data that they had as of now. They do plan to have assigned seats. They plan to board students whenever they can, so they don't cross paths. They board the rear first. And I think that's about where we are for right now. We will learn more. I guess what I would add is there's a statewide driver shortage that has logistical challenges that hasn't impacted us yet. We didn't reduce any routes because of that, but it's something on the radar screen as well.
We did have a lot of parents, I just remember from the lines I would see outside of Toflon going down Northwest Drive and other schools as well. A lot of parents driving their children, and you know, at every school, Wheeler, Toflon, so that is still an option, of course. It poses some challenges logistically, but that's certainly every parent's right. You know, for those children who are in busing distance, busing range, you know, we afford them a seat on a bus by state law, town board policy. So, you know, we'll do what we need to make it work within the constraints that we have on our buses. But we get as creative as we can. And they did a really good job last year. DACO's been a good partner with that.
Any other questions from the board? If not, I'm gonna ask for a motion to adjourn, but I before I do so, I would like to really thank everybody for being here, you know, and for the public and members of the public who commented. We appreciate your time and your comments. We know that it's not easy sometimes to talk in public, but we appreciate that and your feelings. So given that,
Dr. K is
Kay's
putting his
raising
hand
his
up.
hand.
I'm used to that in the school system. I'd like to say thank you to Superintendent Lepage and to our governor. We're very lucky to have a governor who respects the science and doesn't push superintendents to fight for what's good for students and potentially put their jobs on the line or pay on the line to do what's right. And when false ideas about health get rooted, it's very hard to get them out of the system, as we've paid attention during this meeting. It's very difficult. There's this quote over the archway to Harvard Law School, and it says, "We thank God for the laws that make us free." Like, these rules are necessary for a well-ordered freedom, and putting on a mask that helps people who can't be vaccinated, really, is that a hard thing? Is that tyranny? No, that's common sense and good practice, and that's all that is. And there are some concerns that people might have that it could cause some jeopardy to children in the long term. You know, it's worth looking at, but I don't expect that it amounts to really much. And for myself, looking at the flu in the future, when you look at the flu rates in Asian countries that wear masks routinely, they're very, very low. And so I think that's my inclination in the years to come. During flu season, I'll put on a KN95. What the heck? I don't want to get the flu. And some people wind up hospitalized, and a very small percentage die, maybe 30,000 a year out of the country, with millions getting it. But even that small amount, I'll put on a mask to prevent that. What the heck? So again, thanks to Superintendent, and we should all be glad we have a governor who's got his head screwed on right.
Thanks for joining us, Dr. K.
You're welcome.
Great. Can I get a call for adjournment?
Motion to adjourn.
Thanks, Deb. Can I get a second?
Second.
Who was that? Rebecca? Rebecca's second. All right, all in favor, please say aye.
Aye.
Any opposed? All right, thank you all very much. Again, thank you all to the staff and to the residents who came out and listened and spoke. We really appreciate it. Thank you, everyone.
Thank you.
Thanks, everyone. Have a good
Good
night.
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 Bye.